여기 체크하시는 보니까 121가지나 되는데 이 중에 어떤 증상이 가장 본인을 심하게 괴롭히는 증상입니까?
Probably the cervical instability and just general pain when eating and back of the head and in around the joint area, neck area. It gets really fatiguing
when you eat and talk.
Eat and talk for long periods of time. Vision in the left eye, it can be quite troubling due to the lack of proper binocular vision and the depth perception.
눈치는 안 보이는 지 얼마나 되시나요?
Probably 6-7 years.
그럼 후두부활의 근육통 심한 거는 몇 년 됐나요?
About the same.
주 증상이 턱관절 장애라고 했는데 이 턱도 아픕니까?
Yeah, well, it's consistently the left side.
왼쪽 턱이 아픈 지 얼마나 됐나요?
It started getting worse probably about 5 years ago, and it's been consistently this way, the same since then.
그럼 그 전부터 아팠었나요?
Not really in the jaw, just started at around that time. There were other primary symptoms before that, but it wasn't until like 5 years ago that the jaw started
So
causing
first
me.
it was this side and then progressed to the
Yeah.
TMJ.
Yeah. Well, for the TMJ, it's been around 5 years, but I've been dealing with all sorts of neck problems probably since the onset of when I had my first concussion in 2012. The neck injury was overlooked at that particular time, so they just focused on the concussion symptoms, and it wasn't until like 4 years after that.
For the neck and your concussions, like 6 years, and for the TMJ 5 years. Is that correct?
The concussion was like 2012, and
TMJ 5 years.
Yeah, 5 years.
몸이 어떻게 손상됐나요?
I was playing soccer. No fracture, no surgery. Just
injury.
whiplash was diagnosed way later after the fact. They
So you didn't receive any treatment?
basic physiotherapy and things like that.
그럼 어떤 진단을 받았습니까?
I was diagnosed with a concussion at that point. Years later, I ended up seeing upper cervical chiropractor, and he said there was C1, C2 misalignment, foramen magnum misalignment, and misalignments down every level of the spine to the sacrum, pretty much.
몇 차례 뇌진상을 당했었나요?
Two. First one was April 2012, and the second was June 2012.
입을 한번 크게 벌려보세요. 맥시멈.
Maximum as you can.
그리고
Close it.
입을 벌릴 때 통증이 생기나요?
Left side, and I feel a lot of strain in the cervical area, the C1-2 area.
맥시멈. 살았어 5cm. 개구장이들 있네요.
And I also notice when I eat a lot, I feel almost like the muscles around the cervical area pop and loosen to get the full range of motion, then it tightens up again. Then I get lots of pain in the zygomatic area, sometimes the maxilla, palate.
그 다음에 또 불편하신 데가 어딘가요?
Yeah, just generalized oral fascial pain, and I do get a lot of ear pain. Sometimes I get sharp shooting and nerve irritation, and sometimes I feel like I have chronic sinusitis at times.
귀의 통증은 언제부터 시작됐나요?
5 years ago, and when looking at me, it's pretty noticeable that my left shoulder girdle is higher than my right.
근막통은 언제부터 있나요?
Myofascial pain is really common. I usually get it about the same time as.
또 그 다음에 불편한 데는?
The only other thing I've had for TMJ, because the person who I went to see before, he only gave me a nighttime oral splint. Because I only was bruxing during the night, so he didn't think anything was necessary during the daytime.
지금도 착용하고 있나요?
Yeah, I wear my
Now
splint.
그 다음에 또 불편한 데가 어딘가요?
Those are the chief complaints, for sure. I think I can add a good bit of context. I also did do physiotherapy to help with the concussion and TMJ, but a lot of the exercise program they assigned, like an SCM stretch or stretches for the scaling, sometimes it caused further aggravation and caused it to pop. and cervical stretches causing the neck to pop and feel unstable as well. It didn't get worse, but they never really addressed why it was happening or why the range of motion in my neck or mouth was limited to that extent. They just told me to keep going back and never gave a physiological reason why their stretches were causing the popping.
그다음에 또 불편한 게 있나요?
Yeah, the structural imbalances. Yeah, when I walk, left leg it was confirmed by my chiropractor that it's about an inch shorter. Left leg is shorter.
근육이 난청도 있는데 뭐 혹시 보충 일체가 하고 있나요?
Yeah.
And you have
But
that
the hearing aids are just specifically for tinnitus masking. To mask the sound and get rid of it.
뒷목, 어깨, 등 통증도 여기 7점 수준으로 심하게 아프다고 표현하는데 맞나요?
Yeah, sometimes it's pretty bad, especially what feels like in the front and the compression of there's a worse.
고통도 자주 있나요?
It's pretty much constant. I'd say the worst segment of my neck is in the thoracic outlet and brachial plexus area. Just feels like sort of the front and middle, and then it extends down into my arm.
통증 때문에 그럼 진통제나 뭐 근이완제 같은 거 드십니까?
No muscle relaxants, but I take pregabalin daily, and when it's bad, sometimes I also take tramadol.
Lucky.
Now it's locked.
Not lucky. Lucky. Okay? Take it. 어떻습니까?
More lightheaded, more clear.
뒷목이 좀 불편하다는데 편해졌는지요?
Less strain, less compression, and discomfort in the back of the head.
머리는 상쾌해지지 않았습니까? 눈도 상쾌해지고.
Yeah, more clear-headed, more
네.
light. Just quicker thought in general.
이제 치료될 수 있다는 확신이 듭니까? 뭐?
Open it maximum
That's the moment.
and stay still in this position.
지금 목, 어깨, 등 불편한 데 있나 한번 움직여 보세요.
The last is in the left side, left burn in the suboccipital on the left side.
10개만큼 아까 긴장이 됐었다면 몇 개가 줄었나요?
4.
오늘 컨디션 어떤가요?
So this morning I woke up feeling pretty irritable. There was a lot of sort of like confusion and disorientation with really tight neck muscles on the left suboccipitals. There was nerve pain and
치료 받기 전에 비해서 통증이 10개라면 몇 개가 줄었나요?
pain feels worse in the thoracic
So it's like
outlet.
zero, no changes.
No change. Consistent burning, nerve irritation in the suboccipitals, brachial plexus, thoracic outlet, into the shoulder blade too.
안 하던 운동, 스트레칭, 훈련을 해서 일시적으로 그런 거다. 힘든데도 똑같이 계속 시간을 늘려나가서 최대한 많이 10분도 가능하면 10분도 늘리고 이렇게 하면은 당장은 괴롭고 며칠은 불편하고 아프지만 더 빨리 날 수 있다. 주중장이 그래도 어제는 10%였는데 오늘은 15% 좋아졌다고 했는데 총 4일간 치료받았는데 오늘까지 컨디션 어떤가요?
I'd say the Saturday there was a big deviation, classified probably as emotional and sensitive. Emotions were like a roller coaster. When I tried to do some of the exercises like the cervical, the TMJ stretching, I felt like a popping in my neck, and that just started up again since I started again. So it's like the muscles were giving way, then popping, and on Saturday met up with a friend, went to Suwon, did lots of walking.
이 후두부 근육통이랑 턱 통증은 어떠나?
It's fairly similar to what it was before. A lot of pain in the left suboccipitals, trapezius, shoulder blade, mostly limited to the left side. After walking yesterday in the evening, my pelvis really hurt and lumbar area really hurt. So muscles tense up and compressed, and there was like neuropathic pain. Feels like it's more neck pain than proper jaw pain.
So it's better?
Yeah, the jaw pain feels better, and it's just everything that's below that is causing a bunch of difficulty.
Okay.
잠은 잘 자냐?
The last couple days were better than when I initially arrived. I could actually get some semblance of sleep as opposed to just like feeling like I spent my entire night just with my eyes closed.
그 전체적으로 처음에 비해서 한 몇 프로 정도?
20% as a whole, I'd say. 20%.
오늘 컨디션 어때요?
Today's not too bad. I feel more refreshed from my sleep last night, so it wasn't very difficult to wake up. Upon waking, I noticed some weird feelings in both sides of my jaw, sort of like an itchy sensation on both sides, similar to what I noticed doing some of the exercises yesterday, like the lying down on the spine one. I felt that itchy feeling mid-thoracic and also in the tailbone. But that only lasted like an hour or so, then went away.
좋은 현상이다. 치료 시 변화 반응이다. 목 뒤에는 어떠냐?
A bit better.
Like your head.
A bit better today, but yeah, it's better towards the back of the head than more painful on the SCM area.
So how much better is the pain?
At this moment, I'd say it is in the range of 30 to 35%.
땜새 페이는 어떠니?
A fair bit better in that. About 45 to 50%.
입 얼마나 벌리는지 한번 치시죠.
5.7?
오, 5.7? 이제 네입 벌어지는 건 정상으로 다 벌어진다.
He's asking if there's pain or not, like anything
Not in the
remaining.
jaw, just all the pain that is in the neck.
전체적으로 네가 몇 프로 정도 좋아졌다고 생각하나?
40% about.
이번 주는 어떤가요?
It was pretty low. Pains a spike in increase in the thoracic brachial area, left pelvis, and yesterday also in the return have some bilateral facial spasms with some trigeminal irritation, so I guess that decided to revisit and make a return. Bilateral trigeminal
After
spasm.
that.
I was just joking, I said it decided to make a return.
후두부 근육통이랑 턱통증인데 그건 얼마나 아프니?
So jaw pain was 7, and neck tension and pain like fluctuates between like 5 and 6.
전체적으로 몇 프로 정도 좋아졌다고 생각합니까?
70.
컨디션 어떤가?
The jaw's pretty okay for the most part, but I didn't sleep well at all last night. I woke up like at 4:30 with lots of pain in the back of the neck, left side, lots of pain in C6, C7, and lower thoracic lumbar area. So it was like a lot of nerve compression, pain, and tightness.
It's like thoracic and lumbar pain too.
Yeah.
이제 한 3일 후면은 한 달 되는데 오늘까지 치료 결과를 평가한다면 어떻게 생각하니?
Yeah, almost all the jaw pain has subsided, and it's just mostly dealing with other underlying structural issues right now that's causing the main problems that I'm dealing with right now, like the thoracic and pain in the body, the pain elsewhere in the body. For the most part, yeah, I'm satisfied with that.
이제 앉아있는 딱 보면 어깨 높이가 같아졌다.
And then balance now.
컨디션이 어떤가?
Pretty similar to yesterday. I don't really find I have that really much pain in the jaw at all. It's just really a matter of physically conditioning the rest of my body and getting strong again, because physical condition's better, but there is a long way to go in terms of getting stronger and having pain reduction throughout the rest of the body.
그 통증이 아우르고 텐으로 한 몇 점 정도 수준이냐?
Pain-wise, it's like at a 4 or 5. TMJ is probably 8.5 better now, and cervical is about 7.5.
네 근막통 증후군은 몇 프로 정도 좋아졌나?
Probably 8.5, 9.
넘어가요.
다 넘어가?
네.
10cm는 벌어지고 네 이제 개구장에는 완전히 다 해결이 됐다. 너의 컨디션이 어떠니?
It's pretty good. Energy levels are fairly decent. Experienced less popping in the left side of the jaw, so it doesn't happen very often. Maybe the only bad thing is I woke up with some pretty painful lumbar symptoms. Yeah, maybe I think if I lay on a CST pillow on the back, maybe that should be good.
턱 아프면 어떤가?
It's like between 85 and 90% better, so there's just not much pain left. I don't know.
후두부 통증은 어떠냐?
I'd say around 80% better.
그리고 이명증은 어떤가?
4.5.
요즘도 보청기 착용하냐?
I'd say the overall clarity of hearing is better. Like when things were really out of alignment, like hearing was pretty muffled and not really that clear. So overall I can hear the things better. Just, yeah, the tinnitus still remains, but hearing is better.
치료를 이제 다 마쳤다고 생각하니까 어떤 생각을 합니까?
Well, I think the process is very thorough with each individual treatment. And that's a big question. What do I think? I think it's really effective, even though it has its ups and downs. Even in such a short period of time, I managed an alleviation of pretty much all my chief complaints.
가장 많이 좋아진 것은 뭐가 있을까요?
Definitely TMJ pain, cervical pain, fixing the underbite, having teeth aligned, and just fixing a large part of the scoliosis and structural instability of the spine.
만족스럽게 치료되고 가서 저 역시 많이 기쁩니다.
Goodbye, shake.